Came across a story which is potentially some very good news here for people with metastatic prostate cancer. It's a new treatment, shows a lot of promise. Dr. Fred Saad is a uro-oncologist at the CHUM and a prostate cancer researcher at the Montreal Cancer Institute. One of the researchers, by the way, involved in the study. He is on the line. Dr. Saad, thanks for being here this afternoon.
My pleasure, Aaron.
Let me begin by asking, when you hear that kind of news that there's promising hope here, it's always important, I guess, to provide details because this is not an across-the-board kind of solution here. There are specific cases that you're looking at?
Yeah, exactly. I think people are well aware that, BRCA, it's a gene that's transmitted in breast cancer. That's very well known, and you know how aggressive that disease is. Well, we've discovered over the past several years that it exists also in prostate cancer, these kind of genetic abnormalities that make the cancers more frequent and harder to treat. And so we've been working for several years on new treatments that address these specific patients, and we've made real significant inroads over the last few years in patients in the last-ditch effort, and this is really the first big trial to be positive in patients who are newly diagnosed with metastatic disease rather than waiting for them to fail all sorts of lines of treatment.
So to clarify then, someone who's dealing with just, if I can use the term generic prostate cancer and is not dealing with this, the BRCA gene offshoot in this particular case, this doesn't necessarily apply to that treatment for those people with that kind of prostate cancer?
Yeah, exactly. We have really good treatment. We've prolonged survival with metastatic prostate cancer now. We're continuing to improve. This group of patients with these genes, BRCA and others, make up about 25 to 30% of men that present with metastatic disease. So it's not an insignificant number, but these patients really have given us a hard time because they don't respond as well and as long, and they're at much higher risk of actually progressing and unfortunately dying of prostate cancer.
Okay, so in this particular case, this treatment extends that time frame?
Oh, absolutely. I mean, and this was presented and we published this in New England Journal because it's so outstanding as a result, where over 50% of the patients in this trial of 600 patients delayed significantly the time the metastases progressed, that they failed therapy. So that's over 50% improvement. And in the patients with BRCA, which made up about a third of the patients, it was actually 63% reduction in the risk of progressing in their disease and ending up having to go to chemotherapy and other lines of therapy. So that's really, outstanding. And we almost take these patients that have these genetic abnormalities back up to patients, like you said, that are more generic type, which is really amazing that we bring these people back to a state that's easier to treat.
So the news is obviously very, very positive. It's very promising, as I said off the top. Can we extend this, or is it too soon to talk about, overall patient survival from this?
Well, so far we're seeing an improvement in overall survival by about 23%, which is, quite amazing, given that the patients that weren't treated with this experimental were getting the very best we have in the world. So we're just improving on the very best treatment. And it's too early to say just how much we're going to be improved survival. That'll be in the next few months, maybe next year, because then it'll be mature enough. But we're already seeing that we're able to do better than the worldwide standard of care, which is really where we want to go to try to make this disease a chronic disease rather than a lethal disease. And we're aiming at that because we can't cure these patients, unfortunately, but we haven't cured HIV, we haven't cured diabetes. We've transformed those lethal diseases into chronic diseases, and that's what we're really working for in prostate cancer.
So someone might be listening to this, knowing a family member or dealing with this on their own, and this is very encouraging news. But I guess the next question should be, beyond these clinical trials and this the great news that you have from them, the positive results, how soon till this becomes sort of the mode of treatment?
Yeah, so these kind of treatments are already approved for patients who have already failed the first lines of treatment. So I think it's going to be very easy for us to convince our governments to get these approved much quicker now for these patients that are diagnosed with metastatic disease. But the last take-home message is we need to be testing for these genetic alterations. This is still not routine to look for these mutations. And that's where we really have to make an effort as a medical community and even for patients to advocate to be tested. if they have these mutations, because we can really do something. And this is the first step in personalizing care.
So to understand then, if you don't even know that you have this mutation, why would you even be going in for a test if you have a prostate issue to begin with and then do it at the same time?
Well, that's right. If you come in with aggressive prostate cancer, it should be a reflex now, and that we're doing a lot of education to be testing these people early to know if they harbor these genes, because it completely changes the prognosis. But now we have treatments. Before it was useless to test. We couldn't really do anything about it. Now we have things that we can actually do about it.
So would this mean as well, if this worked on you, if you're, a person who sort of fits the bill here, that you could avoid some of the chemotherapy and the other, sort of traditional treatments that you would have to undergo now?
Yeah, that's what we're trying to do, is find alternatives, but at the very least, delay those alternatives of chemotherapy and all the rest, and keep patients well and stable and under control. In remission is what we're doing. And it's really an advance forward.
Yeah, just as a final question for people listening, as I said, who are thinking, okay, I've been diagnosed, make it a point to ask whoever you happen to be, whoever your doctor is, to check for that. You say you're hoping that becomes kind of the routine, but for now, you should actually be asking to be checked for this?
Yeah, absolutely, especially if you're metastatic. These are the patients that really, if you just have a very small cancer, it's really not yet the standard of care. But patients with aggressive disease, these patients are at higher risk of harboring these mutations. And especially if you have a family history. If people in your family have breast or ovarian cancer, you're at a higher risk of having these mutations.
So whatever you do, kind of make it a point to say to be checked to find out if you have those mutations, because that would mean, based on the research you're doing here, a much more positive and longer outcome.
Absolutely.
All right. Dr. Saad, thank you so much. I appreciate your time today.
Great talking to you, Aaron.
Take care. So there you go. Good news. Again, because it's the kind of thing that men, depending on your age, I think over 70, they say it's so prevalent. These are things you want to do if you are being diagnosed with a prostate issue, prostate cancer, and ask to have, that gene, find out if you in fact are carrying that gene, because there is new treatment, and that's positive news.
Hello, Canada.
This is Bryan Adams Radio. Hosted by Bryan Adams himself.
We'll play a few of mine, a ton of my favorites, and some must-hear behind-the-scenes stories from the world of rock and roll. I'm coming to get you! One thing about doing rock and roll so long is you end up meeting a lot of the people that you admire. Sometimes you even get to work with them.
It's only love, and that's all. Bryan Adams Radio. I'm coming back to you. Now available on the free iHeartRadio app.
Hey everybody, how are you tonight? Sounds great.